Today we are going to talk about how to increase your anesthesia revenue through specialized billing services. Currently, hospitals and health systems are facing more competition and belt tightening than ever before. The financial impact of bundled Medicaid payments, the increasing costs of staff and supplies, and increasing drug prices means that hospitals need to maximize their revenue wherever it's appropriate. Some hospitals utilize a single service for all their medical billing. The general medical billing services are built to generally maximize revenue across all departments. So, in general, this works. However, anesthesiology has specific specialties and unique billing procedures. The generalized billing services are not optimizing billing and collections for anesthesiology, which means that they are not collecting as much as they should or could be collecting. That equals a loss of revenue. In addition to loss of revenue, generalized medical billing services risk regulatory compliance problems and allegations of fraud when coders try to handle the complex work of anesthesia billing without specialized software or anesthesia coding skills. For example, one major company was recently sued for a seemingly simple mistake. Their software's default setting led to anesthesia billing to be inappropriately charged. It appears that a 30-minute 4-base unit procedure would have been billed at 34 units, 4 base units plus 30 minutes, rather than correctly billing at 6 units, 4 base units, and 2 time units. This went unnoticed by the general billing experts for so long and caused numerous clients to be fraudulently double billed to Medicare and Medicaid by hundreds of millions of dollars. This simple programming mistake is a testimony to the specific knowledge needed for billing anesthesia services. Even a great organization with top-of-the-line technology and experts on medical billing will fail anesthesiology billing if they don't truly understand the specialization and specifics of anesthesiology billing. Anesthesia billing takes 100% focus. General billing systems will work well for 90% of the billing situations that your hospital faces, but not for anesthesiology. Did you know that a specialized anesthesia billing agency can increase collected revenue in that department by up to 15%? It is important to understand these differences in billing because anesthesiology billing and collections is complicated. If your facility treats anesthesia billing as a task to be handled by generalists, it will result in lost revenue and unnecessary exposure to regulatory liability. This video will explain how to maximize anesthesiology revenue, whether the revenue cycle management is being contracted out or done in-house. The first step to maximize your revenue is a painless handoff from physician to billing. It needs to be a simple process so that your anesthesiologists can focus on what matters most, the patient care. Anesthesiologists need to be able to submit their notes and trust the billers to get the coding details correct. Secondly, you need specialized people. All coders should be certified by the AAPC and deeply experienced with anesthesia billing. They need to know every anesthesia modifier type, qualifying circumstance, physical status modifier, and have a complete understanding on how to calculate time for anesthesia services. Even experienced medical coders can and will make mistakes if they don't have specialized training with anesthesia procedures. You also need specialized systems. Generic medical billing software is simply not going to bring your anesthesiology department to maximum collections. While there are some commonalities across billing processes for the various specialties, there are also some key differences. For example, Fusion anesthesia systems are a hybrid off-the-shelf billing systems and custom-developed reconciliation and reporting software and databases, coupled with good old-fashioned human experience, persistence, and service. Attention to detail and rapid turnaround are critical. Billing turnaround time should be standardized and rigidly adhered to. Claims should be checked and rechecked for mistakes prior to submission for repayment. At Fusion Anesthesia, we check every claim 5 times. Twice by humans in-house, once by our own automated systems, and then twice again by our clearinghouse vendor. The fourth item you need to maximize revenue is a meticulous reconciliation process. Payers are constantly renegotiating payment schedules that vary depending on both the hospital and patient in question. The result is a complex matrix of contracted rates for any given procedure. Most payers are not able to keep up with this ever-changing morass of contracted rates. The data tends to run a little behind the calendar, so payments are either a little more or a little less than the actual contracted amount. it's hard for payers to keep track of how much they owe. It's even more daunting for hospitals with their billing and revenue services. Most revenue cycle management departments only reconcile at the macro level, shrug off what appear to be minor discrepancies, and move on. The problem is, healthcare costs tend to go up rapidly. So, if payers are paying based on outdated data, on average, they will measurably underpay for their contracted obligations. This is what we see in the real world. The only way to combat systemic underpayments is to reconcile every payment versus contracted rates on a line-by-line basis. However, that is impractical for most hospitals and general medical billing services. Fusion Anesthesia has successfully tackled this problem for anesthesia departments nationwide. We load and consistently maintain the fluctuating reimbursement rates for every payer, every service, and every hospital in our system. It's a big job and only practical because of our singular focus on anesthesia. Our proprietary database of contracted rates paired with customized software allows us to cross-check every line item of every claim to make sure that it meets the hospital's contracted rate with that specific payer. If we find a mismatch, we automatically kick it back to the payer to ensure your hospital is getting the contracted rate. Guess what? We kick back a lot of these items. As far as we know, Fusion Anesthesia is the only player in the industry that loads, reconciles, and pursues the fluctuating reimbursement rates for every payer and every client in our systems. This is a major reason we are confident that we can collect significantly more for hospitals than a general billing company or in-house staff. Just for fun, check out the line-by-line reconciliation for the past 6 months of billing for your anesthesiology department. If it doesn't exist, or if it doesn't show that significant percentage of the claims for payments were kicked back because they didn't meet your contracted rates, then your hospital is being shortchanged by your payers. One last thing you will need to maximize your revenue is integration to existing systems. Anesthesia revenue cycle management and reporting must be integrated into your existing financial systems and must comply with HIPAA standards. For instance, Fusion Anesthesia offers both powerful standalone reporting and seamless integration into your existing financial and HER systems. To conclude, anesthesia is uniquely hard to bill. Coding for base units, time units, and modifying units, combined with the unique requirements of dozens of major payers, results in a recipe for coding errors and underpayments. In-house coders and general billing companies simply can't apply the level of detail needed to accurately bill for anesthesia services. To maximize revenue and minimize liability, hospitals should work with specialist billing companies for their specialized practices like anesthesiology. Fusion Anesthesia is here to help. Fusion Anesthesia provides billing and accounting services to over 400 anesthesiologists worldwide. Our expertise enables hospitals to collect an additional 5 to 15% in anesthesiology revenue compared to what they were previously collecting.